Hi, I'm Dr. Larry Malerba, and welcome to the latest installment of the clinical case series here on the All Things Homeopathy YouTube channel. Today's case involves Charlene, a woman in her 60s who had consulted me in the past for treatment of an arthritic condition. She returned recently with a complaint of chronic throat pain that had persisted in spite of allopathic treatment. About a month prior, she had developed a painful sensation as if there was something stuck in her throat. Her ear, nose, and throat doctor diagnosed the problem as acid reflux and prescribed prednisone in addition to a steroid nasal spray, all to no avail. I asked Charlene to describe the symptoms in more detail. She said it was a hot, burning pain that occurred on alternating sides of her throat, although she tended to feel it more frequently on the left than the right. The pain was worse on waking in the morning, worse after breakfast, and it felt better after drinking a cold drink. She also reported that she had a postnasal drip. Now let's use the repertory to look up a few of these symptoms. I chose the rubric, painful lump sensation in the throat, which we see here, to represent Charlene's main complaint. Here we have throat pain alternating sides, which is a symptom strongly associated with the remedy lac caninum, as you see here. And because it was predominantly left-sided, I chose left-sided throat pain here. And left-sided burning throat pain here. Here we have the modality throat pain in the morning on waking. And here we see another modality, burning throat pain after breakfast. And here we have a particularly reliable modality, throat pain that feels better from drinking a cold drink. Cold drinks ameliorate. And finally, I chose a rubric to represent postnasal drip. Here, mucus in the throat, drawn from the posterior nares. Note that this symptom is quite prominent for both natum muriaticum and calibachromicum here. As you can see in this repertorization, the remedy lachesis comes out on top with lac caninum, calibachromicum, and natum muriaticum coming in a close second. Lachesis is listed for 7 of the 9 total symptoms, while the other 3 remedies are found under 5 of the 9 symptoms. Now, just because lachesis comes out first in the repertorization doesn't automatically mean that it's the correct remedy. So I asked Charlene a few more questions. When I asked if she had any other concerns, she noted that her blood pressure was higher than usual during her doctor visits recently. I asked her about her emotional status, how she'd been feeling lately. She replied, "Lots of frustration. Sometimes I'd like to shoot my husband." Now, although I knew that this wasn't meant literally, clearly, it was a sarcastic expression that indicated the degree of anger that she'd been feeling toward her husband. So now, let's add a couple more rubrics to our repertorization. We can see that with the addition of sarcasm here, and hypertension here, it makes a much stronger case for the remedy lachesis. We see that lachesis now covers 9 of the 11 symptoms chosen for analysis, while the next closest remedies fit only 6 of the 11 symptoms. In reality, I didn't have much need for a repertory in this case because a good number of the symptoms were common keynotes for lachesis. Lachesis is well known for left-sided sore throats that are worse in the morning and better from drinking cold drinks. It's also a commonly indicated remedy for high blood pressure, and lachesis can be a very useful remedy for those who harbor hidden hostility, barely holding in their anger. Although Charlene's postnasal drip made me consider Nat Muir and Callie Bick, and the alternating side symptom made me consider lac caninum, in the end, the totality of the case pointed toward lachesis. Lachesis is a remedy made from the venom of the bushmaster snake. I prescribed 2 doses of lachesis 30C. After some time had passed, Charlene reported back to me. It went really well. My throat was fine within a few days, and my blood pressure has been good too. It's been reading in the 120s over 60s. She felt better able to cope with her husband. She also noted that my ear, nose, and throat doctor was surprised. He asked me how I healed myself. As is often the case with patients who are concerned about potential disapproval from their conventional doctors, she didn't reveal that she had resorted to homeopathic treatment. Now, it's worth reflecting on some of the lessons illustrated by this case. First off, acid reflux is an overused and often inappropriate diagnosis given to a lot of patients who present with chronic unexplained symptoms in the region of the throat or larynx. But that's the nature of cookie-cutter medicine. Patients frequently get lumped into one-size-fits-all diagnostic categories where they do not belong. This usually happens by default because there are only a finite number of diagnostic labels. This brings us to one of the most important advantages of homeopathy. Homeopathic prescriptions are not dependent upon diagnostic stereotypes. Treatment is based upon the unique symptom pattern of each individual patient. As you can see, Charlene's remedy was not chosen on the basis of her diagnosis of acid reflux. Lachesis was chosen only after careful case analysis and thoughtful case-taking. Secondly, conventional medicine increasingly turns to corticosteroid drugs when faced with no other options. It used to be the case that steroids were understood to be drugs of absolute last resort because doctors knew how powerful and dangerous they could be. Nowadays, though, the medical establishment appears to have abandoned that caution. The same class of drugs is now prescribed far more liberally than in the past. In fact, topical steroids can now be purchased over the counter without a prescription. In my medical opinion, steroids are powerful immunosuppressants and, as such, should be used only when necessary as a last resort, if at all. Luckily, in Charlene's case, prednisone did not help her condition. I say luckily because when steroids do work, they work by suppressing symptoms. And when symptoms are forcibly suppressed by such means, the original problem has a tendency to mutate, or to metastasize, if you will, and the new problem that emerges is frequently quite a bit worse than the original problem. The good news is that when used properly, homeopathy helps the body heal itself and is almost never suppressive. Thirdly, this case illustrates once again the undeniable connection between body and mind. As far as I'm concerned, there's no doubt that Charlene's physical symptoms were a result of her internal emotional distress. Conventional medicine might criticize such a notion as speculative. Even when it does acknowledge the connection between mind and body, it tends to downplay it as merely psychosomatic. In other words, medicine tends to minimize the seriousness of such connections. This is why conventional medical treatment so often misses the mark. It fails to take mind-body phenomena seriously. In Charlene's case, the psychological dimension of the problem was not even considered by her ENT doctor. Steroids were prescribed because her throat pain was believed to be a strictly physical ailment. Homeopathy, on the other hand, is not limited by the materialist philosophy that so severely hinders Western medicine. In fact, from a homeopathic perspective, there is no boundary between mind and body because they are considered to be one and the same. And finally, of historical note is the fact that the venom used to make the original lachesis remedy was extracted from a South American bushmaster snake by the renowned homeopath Dr. Constantine Herring. In 1830, Dr. Herring donated the snake from which he extracted the venom to the Academy of Natural Sciences. What's truly amazing is that the very same specimen, pictured here, still resides at the Academy, which is now part of Drexel University Medical College in Philadelphia. To give you a sense of the degree of confusion that surrounds homeopathy, there are those who mistakenly claim that a remedy like lachesis, which is derived from a snake venom, is a dangerous toxin. Strangely, there are others who hold the complete opposite view. They claim that homeopathic medicines can't possibly work because they're nothing more than placebos. Certainly both can't be true. You tell me, which is it? Is homeopathic lachesis a dangerous poison or a useless placebo? All I can tell you is that neither claim is true. If it were, I would never use the remedy in my own medical practice. Well, I hope you enjoyed this latest installment of the Clinical Case series. Don't forget to subscribe, and I encourage you to share this video. Together, we can provide accurate information to the world about the healing power of homeopathy. Please tune in again next time to the next episode of All Things Homeopathy.